I'm a very active person now. All I want to do is sit at home, sit in my room, lay in the bed. Instead of getting out of the car, trying to do things, I'll sit.
Like many women, Wanda Jackson has benign fibroid tumors in her uterus. She's known they were there for many years, but until recently they caused no trouble. Now, however, she suffers intense pain and very heavy bleeding with each menstrual cycle.
My supervisor had to send me home from work one day, you know, because of the bleeding. I would go through menstrual pads, 2 to 3 of them doubled together. Yeah, and so the pain, and then also with the pain, it'd be really intense, you know, to where she was like, you know, well, you can just go home. If you feel any better, you can come back, but if you can't, you know, just stay out.
Ms. Jackson sought help from Dr. Andrea Coleman, a surgeon in the Department of Obstetrics and Gynecology at the Detroit Medical Center Sinai Grace Hospital. Dr. Coleman was able to offer a minimally invasive treatment.
A hysteroscopic morcellation, which is a procedure where we place a small camera on the inside of the uterus to aid in the removal of uterine fibroids. And from that camera, we're able to see everything that's on the inside lining of that uterus, which tells us directly where the fibroids are and how many there are, what the shape and size and even the density of them are, so we know exactly what we're dealing with in terms of time, how long it may take us, and if we're going to adequately be able to remove them in totality.
Ms. Jackson was very happy to hear there would be no incision.
Once she informed me that she can do it without cutting me, you know, I was like, yeah. I said, let's give this a try.
Dr. Coleman talked about the simplicity of the procedure.
This is a nice procedure to use for this type of myoma because it's not as invasive as some of the other procedures that we traditionally use to remove uterine myomas. This one is done on an outpatient basis. We're not going to even use general anesthesia. We're going to use sedation and a paracervical block around her cervix. Her downtime will be nil, her discomfort will be minimal. She'll go back to work in a day or so.
Dr. Coleman showed me how the hysteroscope worked.
So I'll place a camera on here, and this is actually the working channel where I'll put the morcellator through. The instrument with the blade that will help me to resect the myomas.
Using the hysteroscope, Dr. Coleman examined the uterine lining.
What's the white feathery looking stuff?
That's a small polyp, and there's another one back here behind the clot.
And that's what you're going to take out?
Yes. This is going to be a piece of cake. So this is the actual instrument. There's a blade in here that goes at about 1,100 RPMs per minute. Okay,
yep.
So we'll use that.
Morcellator.
The morcellator.
Using the morcellator, Dr. Coleman was able to quickly remove the fibroids. The tissue was later screened for cancer.
As you can see, her cavity now is pretty clean. This is normal endometrial tissue that you would expect to see in a patient her age.
This was very quick. It was almost, you were in and you were out.
Yes, and that's the beauty of this procedure. It's not a lot of overkill. It's a very focused and a very direct procedure to take care of a very specific problem.
The tissue was later screened for cancer.
I feel wonderful. As a matter of fact, after the surgery, I went to work the very next day. The very next day after the surgery. Anyone that has to go through that procedure, I really recommend it for each one, you know, because I just feel great afterward. You know, it's just like a whole new lease on life.
For more information about uterine fibroid treatment options or to make an appointment with Dr. Andrea Coleman at Sinai Grace Hospital, visit us here at dmc.org. The DMC, we just think it's a better way to get better. I'm Emery King.